Good afternoon. Thank you all for joining us today for another Cuyahoga County and Board of Health press briefing. My name is Miranda Fortin, and we're joined today by County Executive Armin Budish, Board of Health Commissioner Terry Allen, Board of Health Director of Epidemiology, Surveillance, and Informatics, Jana Rush, and Board of Health Medical Director, Dr. Heidi Gullett. Once the briefing is over, we will be taking questions, but just a reminder to the media who have joined by phone to please keep your phones muted until after all our speakers have presented, and then we will open it up for questions. We will start our briefing with County Executive Armin Budish. Thank you.
Thank you. Hi, everybody. It's great to speak with all of you. I want to begin again by thanking the Board of Health, Commissioner Terry Allen, Dr. Jana Rush, and Dr. Heidi Gullett for all the good work that they continue to do for all of us. Their monitoring, their testing, and their tracing keeps us all safe. Unfortunately, the pandemic is still with us. Anyone can get this disease, even the President of the United States, and it's still dangerous. The weather's getting cooler, and I know that many of us crave contact with friends and with family. But we have to continue to follow the protective practices that the Board of Health is asking of us. Keep wearing your masks and stay socially distanced and limit your in-person contacts. Even as we continue to face the threat of COVID, even as we work to help people replace the jobs that they lost, to save their businesses, people that are suffering and need to stay healthy and safe, we have other challenges that we face as a community, and those challenges have not gone away. The experts tell us that the COVID pandemic has turned up the risks of drug addiction. Many in Cuyahoga County continue to suffer from drug addiction, and many continue to die. This year, COVID deaths in the county will outpace overdose deaths, but not by much. We're working to save as many lives as we can and to help people beat drug addiction. So we're working with Metro Health to significantly expand a program called Quick Response Teams. Here's how it works. Within 7 days of a documented overdose, a team made up of a Metro Health social worker and a member of our Sheriff's Department will visit the home of the person who suffered an overdose. These visits are not a punishment or a threat. Instead, the team is there to offer help and to provide information and a path to treatment. People who have recently survived an overdose are often at risk of overdosing again, but they're also often at their most receptive to getting help that they need. And that's what we want to be there for. If people are open to getting into treatment, we will help them do that. QRT has been tried out in a few county communities, including Parma and some West Shore communities, and it's getting good results. It's been a terrific model of collaboration between the health system and the justice system. So starting this Monday, October 5th, we'll be expanding the program throughout Cleveland and the county. And as an important reminder, if you or someone you know is ready for treatment, please call 216-623-6888. That's the Adams Board's 24-hour crisis and referral hotline. That's 216-623-6888. We want to help people suffering from the disease of drug addiction. Okay, next up. I've spoken here before about racism as a public health crisis and how the county is addressing it. We have two separate groups, one internal and one external, both looking at how we're addressing structural racism in Cuyahoga County. To do the job right, we want your help. We want your ideas and hopefully your solutions. Our Citizens Advisory Council on Equity, which we call CASE, is working with the Cleveland Foundation to host a series of virtual community-wide conversations in the latter part of October. There are 3 separate dates and times that you can choose from. Friday, October 23rd from 11 a.m. to 12 p.m., Saturday, October 24th from 12 p.m. to 1 p.m., and Monday, October 26th from 7 p.m. to 8 p.m. Starting next week, there will be a page live for you to sign up, so keep an eye on our homepage, our county homepage, our social media feeds, and we'll also be sending out a release to the media. These conversations are open to anyone who wants to participate in the conversation regarding structural racism and how we as a community address this long-standing, complex, and quite painful set of issues. CASE will be using the Common Ground platform that's now in its 4th year, which the Cleveland Foundation has used to help gather and amplify many voices across our community. The Common Ground platform supports meaningful dialogue, which in turn helps create meaningful change. We're hoping to have hundreds of voices included in this work. There will be facilitators and scribes who will moderate and capture your ideas and your concerns. And then all of that material will be pulled together to be shared as part of CASE's report back to the community and to the county government for use in crafting initiatives. This work is hard, and it is necessary. I'm committed to open communication and transparency as we move forward. Finally, I want to talk about voting. Voting is one of the most sacred and meaningful ways that we can make ourselves heard. Now, why do I say sacred? Because people have died for our right to vote. Unfortunately, we're seeing the legitimacy of the entire election process called into question. I'm going to make this very clear, very clear. In Ohio, in Cuyahoga County, the process works. Your vote is safe. Your vote is secure. Whether you choose to vote by mail or on election day or before, you can rest assured that your vote will be counted. Our electoral system has been in place since 1778 without being called into question. The attacks on voting are meant to intimidate you. Do not let that happen. Our democracy is strong, and it relies on you to keep it strong. So first things first, if you haven't registered to vote, there's still time. Not much, but there's still time. And it's easy. All you have to do is go to 443vote.us, and you can do it right online. You have to hurry. The deadline to register is this Monday, October 5th. If you're registered, you need to make a voting plan. How are you planning on voting? If it's by mail, you need to get your ballot request in by October 31st. But don't wait. Don't wait till the last minute. Do it now. Then, as soon as you get your ballot, you need to fill it out and send it in immediately. If you mail your ballot promptly, it'll be counted. If your plan is to go down to the Board of Elections to vote in person and early, you can start doing that on October 6th, Tuesday. And that works too. And of course, you can still go to your local polling location on election day. Just make sure that you have a plan in place and that you follow it. For those of you who want to know how else you can support and help, the Board of Elections still needs poll workers. They especially need people who are willing to travel from their residence area to another location in the county. And they need Republicans so that poll workers are balanced between parties. And they need people who speak speak Spanish. So especially if you fit into any of those categories, go ahead and apply to be a poll worker by going to 443vote.us. That's 443vote.us. And if you know people who might need a ride, either downtown or to vote early or on election day, please reach out to them and volunteer to drive them. Remember, of course, that if you do, you have to wear your mask. These are difficult times. They're like no other we've lived through. It's up to each and every one of us to participate in this great democracy. It's our personal responsibility to uphold what others have lived and died for. Finally, I want to address the news today that the President and the First Lady have both tested positive for COVID-19. No matter what your political beliefs are, I hope we can all agree that we do not wish anyone harm or ill health. My prayers are with the President and the First Lady. I wish them both a speedy recovery. Thank you.
Thank you, Executive Budish. As always, we appreciate your partnership and continued support and collaboration across all of your county departments that have been working very closely with us throughout this pandemic. Certainly, we share the concerns for the President and his family and wish a speedy recovery as well. Today, as you've mentioned, I'm joined by our Director of Epidemiology, Surveillance, and Informatics, Jana Rush, who will walk through a portion of our data brief that is now posted on the web, followed by Dr. Gullett, who will also cover a number of clinical components, testing related issues, and similar updates. So yesterday, Governor DeWine announced that we're happy to report that we're still orange, risk level 2, public health emergency level in the public health advisory system for the state. And I believe this is the seventh week in a row that we've remained in the orange rating category. Counties in risk level 2 or orange are advised by the Ohio Department of Health to exercise a high degree of caution. It's quite an achievement to be at orange for 7 weeks in a row, and the credit goes to you. It goes to everyone out there in our community who has embraced the power of public health prevention during this pandemic. So this continues to be very good news, and our indications, again, that we continue to move in the right direction. And you'll hear some other data that validates that as well from both Jana and Dr. Gullett. It's now clear, very clear, that our high degree of local mask use, following a physical distancing guidance, implementing remote work options, promoting hand hygiene, and staying home when you're sick all work. I think that the debate is over there. We need to continue to follow the playbook and do our part to keep our community safe. Our continued vigilance is our way out of this pandemic. We know that we're not out of the woods yet. As Executive Budish mentioned, the flu season is upon us, and we still have the release of the COVID vaccine into next year that lie ahead and are part of our continued response and our way through this pandemic. As of yesterday, there were 17,704 cases of COVID-19 that have been reported in all of the county, including the city of Cleveland, with about 15% of these cases, or 2,600 people, requiring hospitalization. And this has been the highest number of hospitalizations in the state since the beginning of the pandemic. Of the total cases, 3.7%, or 658 people, have died since March. Friends, family members, neighbors, senior citizens, people that matter to all of us have died. And it's important that we take a moment to recognize the losses and the pain that this pandemic has inflicted on families throughout our community. We know this coronavirus spreads easily, and people without symptoms can unknowingly transmit the virus to others. And infectious diseases do not recognize borders on a map. Governor DeWine announced that Ohio will begin indoor visitation, switching gears, indoor visitation at nursing homes, long-term care centers, and intermediate care facilities after closing their doors due to COVID-19. Intermediate care facilities, which is where people are supported that live with developmental disabilities, resumed visits on September 28th, and nursing homes and long-term care facilities can follow on October 12th. Ohio has permitted outdoor visits at assisted living facilities since June and at nursing homes since July. With the cold weather, certainly guidance now needs to be put in place about how you can transition to indoor visits and do that safely. The state plans to limit visitors to 2 at a time for a maximum of 30 minutes per visit. All visitors will be required to wear a face mask and must maintain social distance with family members. And all visitors must schedule their visits in advance, and both visitors and staff will undergo a health screening before entering the building. It's important to know that each facility will make decisions on allowances relative to visitation based on the risk that they see presented in those facilities at any given time. Since switching gears now into flu, since the onset of the flu season, we've been encouraging everyone to roll up their sleeves and get their annual vaccination. I got mine last week at one of our drive-through clinics. The Cuyahoga County Board of Health has been holding their drive-through flu clinics open to the public at our office every Wednesday from 9 to 11:30 in the morning. You can also get a flu shot at our Warrensville Heights clinic by appointment in order to maintain social distancing. As we said on many occasions, if there ever was a year to get your flu shot, this is the one. Pharmacies, hospitals, community clinics all have flu vaccine available, and you can go to fluvaccinefinder.org to find options in your area. The Ohio Department of Health is also developing a media campaign for flu with more information forthcoming. As we look ahead to the flu season and more school reopenings in our community, we need to remember what has worked and stick with it. We've had a high masking rate in our community, sound planning and implementation of school reopenings, and prevention vigilance. It's working. As we've seen in the past, things can change quickly if social contact and interaction without prevention increases in the community. Everyone's tired as we continue to live through this pandemic. Everyone's tired. But we know that ensuring that sound prevention practices that got us here need to remain front and center in our response. This is how we protect our families, our neighbors, our senior citizens, our classmates, our co-workers, and how they protect us. So right now, those are our main messages that we want to share. And it's now time for me to turn things over to our Director of Epidemiology, Surveillance, and Informatics, Jan Rush. Jan?
Good afternoon. Thank you for having me. Today I'll be covering our data brief today and the impact of COVID-19 that's currently impacting the community. So as you can see, we've had over 12,000 cases reported to date. We've had approximately 50 new case reports per day for the month of September, and that has decreased over time. We had about 80 new case reports in August and about 115 in July. So those new case reports are decreasing overall that we're receiving each week, but our new cases continue to increase week over week. We've had 561 deaths reported in our community. That represents approximately 4.5% of our cases. That has remained stable over the past month, but we did have fewer deaths reported this week than we did from the previous week. Our hospitalizations represent approximately 10% of our cases. This has also remained stable over the past month. Over 90% of our cases are presumed to have recovered from their illness, which is encouraging. There has been a slight increase over the past month in the number of cases that we have presumed to be recovered. Okay, so now moving into some of our demographics. So females represent the largest proportion of our cases at nearly 60%. Also for our age group, the majority of our cases are among young adults from 20 to 39 years old, and they represent approximately 35% of our cases. Children represent about 10% of our cases, and that has also remained stable over the past month. So for race indicator, our white race is represented by 49% of our cases, and Blacks represent 37% of our cases. This has also remained stable over the past month. The number of healthcare workers that are represented by our cases is at 16%, and those with pre-existing conditions is at 37%. This number has also remained stable over the past month among cases in our community. So next, we have our epi curve. So our epi curve represents the number of new cases that we have seen in the community by illness onset date as of October 1st. So as you can see with this graph, our highest peak of cases did occur in July to date. And at the end of that graph, some cases may have occurred this past week or so, but we may not have received the reports for those cases to date. So we are moving in a good trend as far as the number of cases that are being reported to us weekly. And next we have our zip code map. So our zip code map also has remained stable over the past month. So as you can see, the southeastern suburbs as well as the northwest suburbs represent the highest frequency of cases here in the county. And this also includes the city of Cleveland as well. So overall, what does this tell us about COVID-19 spread in our community? In conclusion, this is letting us know that there is still increased spread and impact of COVID-19 in our community, but the daily prevention methods that our community members are taking through hand washing, social distancing, and as well as wearing masks is helping to slow the spread of this virus and illness within our community. So we should continue to stay vigilant about staying with those prevention practices as we head into the fall, with more people being indoors over the fall and winter. And that concludes this section of our EPI brief. And so now I will turn this over to Dr. Gullett to discuss our clinical and testing information and data.
Thank you so much, Jana. So I'm going to just finish out the EPI brief that we customarily review each week. And you can see the hospital utilization data in front of you. These are the same 4 metrics that we have been following since March. If you look at the adult medical surgical bed utilization, it's pretty stable in the mid-80s this week at 86%. Our adult ICU utilization dropped just a few percentage points from last Friday at 83%. You can see for the pediatric medical surgical beds, they're at 57% and pretty stable. There was a drop 1 week, but we don't feel, as I have said previously, that this is indicative of more COVID infection in pediatric patients needing hospitalized. We clearly still have infections in pediatric patients, and we have had both hospitalizations and intensive care unit admissions in those age groups, but that does not seem to be representing most of the beds that are being utilized for kids in Cuyahoga County right now. And then you can see that the ventilator usage remains around 40%. It's at 41 this week and has been very similar to that over the past month. In looking at our hospital testing data, we're very pleased that we had, again, over 20,000 tests this week. We had, again, also a low percent positive, meaning the number of tests that are positive over the total number done has remained low for the last few weeks, very similar to last week, this week at 2.5%. And that's a really good thing. What that means is that we feel like we are doing enough testing, that we have a low enough percent. And this is data that reflects 3 hospital systems, so Cleveland Clinic, Metro Health, and University Hospitals. Since mid-August, we've also had public access to nursing home testing data, and that is publicly available online from the Centers for Medicare and Medicaid Services. And the really interesting thing about this is that we now can compare percent positive among nursing home employees and residents, compared that with the rest of the percent positive that we see from community testing and from those in the hospitals that you see above. And interestingly enough, they've been very, very similar since mid-August with the percent positive in the community that we've been getting from our hospital systems. So we're going to just summarize that for you going forward. You see it here, but I wanted folks to know that that's just another element of data that's available and that we're continuing to follow. I also wanted to take just a few minutes to talk to you about ways you can get tested. We're all having a lot of fatigue about COVID-19. You heard Terry talk about that in his remarks. You heard our county executive talk about that in his remarks. We really need everyone to stay vigilant. We know that masks have worked in our community, and we need folks to continue to do that. But we also need people to socially distance and hand wash and all the things that you know are part of our new normal. But the other important thing is that we need testing to continue to be available, and we need folks to get tested. And that's really important, not just for people who feel sick, but if you've been in contact with someone who has it, it's important to also consider testing. So we have published on our website our October testing dates for our community testing plan that we work with the county executives team, Metro Health, and the County Board of Health. And those are sites all over the county, so please check that out. It's free of charge. You do not need to bring your insurance information, and that's available for those 10 and over. We also wanted to share again the website that you heard Jean Polster, a CEO of one of our community health centers, Neighborhood Family Practice. She came a few weeks ago and talked about the community health center testing availability here. And I wanted to again give you that website. It's clevelandcovidservices.com, and that is a collaboration of community health centers across our area, mostly in Cuyahoga County, but also some serve other neighboring counties. And they serve all ages, so there's no restriction for age, and you do not have to be a patient of those facilities. They're simply offering access to testing. If you have insurance, they will accept it, but if you do not have insurance, you will be covered. And so there should be no out-of-pocket costs for people to be tested. So we want everyone to know that we now have access for children and for adults, and we want you to feel that you can be tested if you need it or want it. And that's going to be really important as we move through the fall. Finally, in a moment of gratitude, I would like to thank a few different individuals. The first person I'd like to thank is one of the family and public health preventive medicine physicians who's been with us since the beginning. In March, she jumped right in and finished her residency with us and then stayed on through the end of September through this past Wednesday as a consultant to try to help us with our outbreak response and all of the different pieces of the COVID response. And that's Dr. Amina Egwakor. We're incredibly grateful for your commitment to this response, your commitment to our community, and you will be dearly missed. You're always a light, always making us smile, and always really making sure that we are doing the right thing for the community. So thank you so much for your service. I would like to also thank the countless individuals across our community who have worked tirelessly in the schools, for those who have already opened, keeping everyone safe, and for those who are planning to open, working to ensure those schools and those buildings are safe. That includes school staff and administrators, countless individuals working tirelessly 7 days a week lately. But it also includes a group of public health professionals known as sanitarians that you've heard me talk about before, who are out inspecting schools and other businesses and making sure that we're keeping our children and others as safe as possible. They are tireless. They never expect or demand any credit, but they are the people keeping you safe out in the community. And so we owe you all a debt of gratitude because you do risk your own safety in the community, and we're very grateful for that. So thank you so much for all you're doing. So with that, I will turn it back over to Miranda for questions.
Thank you, Dr. Gold, and thank you, everyone. We will now open it up for questions. So anyone with questions, please unmute yourself, state your name, and please go ahead with your question.
Hi, this is Courtney with theplaindealerInCleveland.com.
Hi, Courtney.
Hi, yeah, I was just wondering, I think this falls to the City Health Department's jurisdiction, but I just wanted to double check. Is the Cuyahoga County Board of Health involved in any contact tracing or response efforts related to anything that may or may not have been spread at the debate or during the president's visit here?
Thank you for your question, Courtney. We're part of the national response system with the feds, the states, and the locals. Certainly, the event was held in Cleveland, as you note. We stand ready to assist. Indeed, if there is a need for us to assist, certainly this is going to be a multi-level response. And so at this stage, we have not been engaged at this stage, but if they need us, we're here, as we have been since March.
Do you expect it to touch the Cuyahoga County Board of Health jurisdiction, or have you received any communications yet that would indicate whether your guys' involvement will be needed?
To date, we have not received any communications that it will involve us. As the investigation unfolds, if need be, we'll be here to respond.
Thank you.
You're welcome.
Hi, this is Anna Huntsman from Idea Street. Can you hear me?
Yes,
Really?
hi, Anna.
Hi. I just was wondering if anyone has any reaction to sort of the news that some people during the debate wore their masks but sat down and removed them during the debate, and when Cleveland Clinic officials asked them and brought masks and asked them to wear them, they refused or just didn't. So I'm curious if any of the Board of Health officials have any reaction or response to that.
Thank you for your question. Certainly, we know that masks work. Governor DeWine passed a mask mandate, way back in Ohio, and we've seen certainly seen the case numbers, positivity rates drop dramatically here, along with a lot of great other prevention initiatives happening. I think, by the way, our schools are doing a fantastic job. I wanted to take a moment to say that we've been on the phone with on calls every week since graduation, last year graduation for schools that happened in the spring, and since that time we've been meeting with them, and they've been planning toward coming back and reopening. They've done a fantastic job. They've been great partners. So people have been getting educated, wearing masks as you talked about. And certainly we think it's one of the key prevention measures. It actually has helped in the Southern Hemisphere to control the spread of flu as well. We heard in Australia with their flu peak period in August that they had a very mild flu season. So we think wearing masks works, and it's a best practice. And here in Ohio, it's a mandate, and we're glad that it is.
So are you concerned then that some people took their masks off and did not wear them during the debate?
Certainly, we had hoped that people would wear masks, and that'll be part of, I'm sure, the process going forward. But we encourage people to wear masks wherever they can. It's worked for us here in Ohio, and we encourage people certainly to wear masks.
And I would just add, it's a rule. You wear a mask. It's not that hard. You put a mask on. And I think it was extremely disrespectful for people to come into a place like that and not wear a mask. And I don't think it's real smart either.
Thank you.
Are there any other questions? Okay, all right. Well, I think that concludes our briefing for today. So thank you very much, and everybody have a great weekend.
Thank you.
Thank you.